Good afternoon, everyone. Good afternoon. Thank you all for joining us today for what should be a very insightful conversation around reopening and HBCUs and the importance that I think we all have with moving forward as we continue to make decisions and plans that's going to impact our campuses this fall. So I thank you all for registering, for supporting this important work that we're doing for HBCU Health. I see some familiar names popping up on the side over here. I thank you all for your continued support of our previous webinars that we've had on the mental health impact during COVID-19 on HBCUs, on how student health centers can play an important role in supporting our students during this COVID-19 pandemic. So I thank you all for just the continued support and the ongoing support as we create this community, or we create this platform for our HBCU student health professionals to continue to engage, to provide the necessary work that's so important during this time period. So it looks like we have several people still continuing to join and to log on. And I just want to thank you all sincerely just for the support. Like I've said, it's been amazing just to have this support. And I think that speaks to the importance and the value of the work that we're doing right now during these important times to support our students of color and support our historically Black colleges and universities, as well as our minority serving institutions. So it's very important as we continue doing this work during these unprecedented times. So thank you all for that. Our conversation today is going to strictly focus on considerations for reopening. And like I posted, you saw in the announcement when you registered, these are not standards that say you have to do this and we're recommending that you reopen. These are simply considerations to support you. That if you do decide as a campus, or if your campus does decide to reopen during these times, that these are some things that you take into consideration as you're moving forward and as you are informing your campus leadership. Because we all know most times decisions that are made about reopening don't always lean to the side of what's most valuable or what's most impactful to the health of our campus and to our students. Sometimes we're looking at the differences between economic outcomes versus health outcomes. And we're going to talk about that a little bit today, but it's important that, like I said, our HBCUs, our minority serving institutions, have a platform or have a source of information that is dedicated, that is focused, that is culturally relevant, and that supports the needs of our campuses and of our institutions moving forward. So that's the entire premise behind the work that we've been doing with HBCU Health. Like I said, our previous webinars that talked about the mental health needs and the mental health support that our students need during these times, and our first webinar that we did that focused on student health outcomes and student health services. So if you haven't had a chance to view those, I would definitely encourage you to do that. You can go to YouTube and you can search HBCU Health. You'll see the full transcripts and the full webinars for our first two presentations. Also, I would encourage you, if you aren't following us on Instagram, we do tend to engage a lot on Instagram, both with other campus health centers, student support services, as well as community organizations that are doing this important work. You can follow us at HBCU Health on Instagram. And like I said, if you go to YouTube and search HBCU Health, you will see the full webinars that we discussed. And this is another part of that series that's going to focus on reopening during these important times. I would encourage you all that if you have any questions, comments, feedback as we're going through this conversation, please use the Q&A box or the chat box. This webinar is streaming live on Zoom as well as through our Eventbrite link. So if you are viewing this through Eventbrite, unfortunately, I won't be able to see your comments live, but if you want to send me an email directly at hello@hbcu.health, I will ensure that I will respond to you directly. Or if I don't have the answer, I will definitely be able to link you with someone in this amazing network that can support you during this time, because that's the whole purpose and the whole premise behind us putting this HBCU Health platform together, is to create a network, is to create a community of student health professionals that can support our students. C. Thompson, yes, I will add the link to the YouTube channel in the chat box as we go through this today. But I just want to have a quick transparent moment. As many of you all have been watching the news and have been seeing what's been going on in our country, not just recently, but I think in the history of the United States. We've lost several individuals over the past couple of weeks. We've lost hundreds of individuals from COVID-19 directly that are from the African American, Latino community. But most recently, we've lost several individuals from police violence and from racism that has permeated throughout the systems that are in this country. And I think it would be invaluable and disingenuous of me not to definitely recognize that, and just be completely transparent that, as an African American male, I struggled a little bit this week. I think the more that you see, violence play out on TV over and over and over again, the more we see young men of color losing their lives on the national scene, playing over and over and over again. We have to just take a moment and realize that the trauma and the impact that can have on the students that we're serving. Our roles as student health professionals, whether you work in this space or not, is to support the mental health, the physical health, the emotional health. All of those dimensions of health are important to support our students of color. And now more than ever, and particularly our African American men, that need is here. And like I said, I struggled this week a little bit because, seeing that play over and over again, and then, having to shift and pivot and still be productive and, still go to work and, still pretend like nothing is happening, is very hard. So like I said, I just wanted to, be transparent in this moment and let you all know that we all are human. And I think it's okay to, have feelings, have emotions. And I think it's definitely okay. And I want to encourage you all to talk about these things, whether it's in your own personal circles, whether it's with your family, your friends, those of you all that are working constantly and diligently using social media to engage your students. I would definitely encourage you to have a conversation around that because there are several studies that have been done. There are several studies that are coming out that are showing that police brutality is one of the number one causes of death for young African American men, and police violence is a public health crisis. And us as public health professionals is very important that we take the time to have these conversations around these topics and ensure that we are in a position to support our students if they are struggling with some of these same challenges. Because if myself as an adult, as a grown healthcare professional who understands health equity, disparities, racism, systematic oppression, if I understand all these nuances and I'm still impacted from a mental health and an emotional standpoint, I think you can only imagine, how this is impacting our students. So I would just encourage you that as you're doing your work, just to take a moment and just be mindful of the current events that are going on and how our students are viewing these situations play out, and how they see themselves in these individuals that are involved in the situations that are going on, after this case, as well as the ones that will continue to transpire throughout our country and as we move forward back to getting on campus. So like I said, I thought it would be disingenuous not to bring that up, considering the setting and considering the population that we have here, that we primarily support students of color. And it's important that we recognize and that we bring awareness to this epidemic that we're discussing right now. So like I said, I just want to thank you all again for joining us for this conversation today that's going to be focused around reopening and some considerations that you should have when it comes to reopening. So I want to share my screen because I do have a presentation and all of the resources that I'm going to be talking about today. I have everybody's email address that registered, so don't worry that if you don't catch something as I'm talking about it, if you want more information about it, or even some of the references, some of the articles that I'm going to be citing throughout this presentation, I'm going to provide an email right after this webinar that's going to have all of those resources available, from the CDC's guidelines for institutions of higher education to the American College Health Association, who put out reopening guidelines, as well as some of our HBCUs that are actually on this call right now that put forth reopening plans. That's essentially what this presentation is centered around. It's taking all of that information, all of those guidelines, all of this information that's out here, and trying to compile it into a comprehensive set of understanding or set of data that you can use on your campus to either support the work that you're doing or have these conversations with your campus leadership. So I just wanted to make everybody aware of that, that we will be sharing all of these resources directly following this presentation. And I would encourage you to reach out if there's something that you want to collaborate on, if there's something that you want to have a conversation about. I would encourage you just to reach out, because that's the whole purpose of HBCU Health, like I said, is to create these collaborative platforms for us to engage and support our students. So like I said, the conversation today is going to be geared around reopening after COVID-19. And like I said, as I'm going through this conversation, if there's something you want to add, if there's a source you want to share, looks like we have about 41 people on the call right now, as well as several others that are watching through Eventbrite. So please feel free to share that resource. Like I said, this is a community and we're trying to collaborate together, to support our students. So please, I'm going through this, I'm going to be checking the chat box and I'm talking because I don't want this to just be me talking at you, because I do know a lot about this, but I don't know everything. And like I said, us as a community have to share these resources with each other so we can make sure that we're all on the same page. And that's something we're going to talk about today, is the lack of a comprehensive set of information that all campuses can use, especially HBCU. So please feel free, if you want to add a question, a comment, feedback, if you want to share any links or any resources to what your campus is doing, please use the chat box, because everybody on the webinar will be able to see that information. And I think it's very valuable and important that we have these conversations. So with that being said, like I said, our conversation today is strictly around reopening. And it's not in the sense of saying when you should reopen or how you should reopen, but essentially we wanted to create a set of guidelines or a set of best practices or considerations that you should take into account when you're having these conversations with your campus leadership, when you're collaborating with your staff in the Health and Counseling Center, even when you're communicating with parents, students, and other faculty members. These are all things that you should be considering, because the landscape of COVID-19 is constantly changing. Every day we're learning something new about what this virus does, how it impacts the body, treatment, methodology, epidemiological factors. We're learning something every day about this virus. And that's why it's so important that as we shape and frame our reopening platform, and as we try to understand and decide, what is that going to look like when we get back to campus on the fall, whether it's in person, whether it's from a virtual standpoint, you have to actually understand the virus itself to be able to shape your guidelines around that. And with it being so much misinformation out there, with it being so many things that aren't true, with things changing every day, is very challenging during these times. And I commend you all that work in this space as you move forward to try to develop some reopening guidelines, or try to create some sense of, I don't want to say normal, but try to create some sense of understanding to be able to support your students. Because as you can imagine, as healthcare professionals who work in this space, and we're still kind of unsure about what to do, you can only imagine how our students are feeling, especially when they're trying to make these important decisions about, do I even want to come back to campus in the fall? Do I want to stay home and go to a college that's closer to my family? These are all the things that are running through our students' minds right now. Am I going to have a place to stay when I get back on campus? We talked about we're going to talk about vulnerable populations, and a lot of our students, as we know, rely solely on the resources that our campuses provide, whether it's food, whether it's housing, whether it's a place to get medical treatment, mental health treatment, exercise, workout, engage. Campuses essentially provide all of these resources for our students. And if there's a cloud of uncertainty around what that campus environment is going to look like, you can only imagine the levels of anxiety and stress that's added to our students, especially our students of color. So you notice here on this slide, we talk about reopening after COVID-19. And you notice that little sentence I put at the bottom: public health for your campus community is priority. That outweighs everything. And I think that's starting to get lost in this conversation, both at the state level and at the national level, when we're weighing health outcomes versus economic stability. And I can't answer that question. And I don't think a lot of people can. And I think that's really the challenge that we have during this time right now, is how do you weigh the public health of a country or a state or a campus versus the economic stability that your campus needs to thrive? Because let's be honest, college campuses are businesses. Like, it's a business. If you don't have any students, you don't have a college. But with that being said, a pandemic that we know very little about, if you have students that are infected or impacted by this, you're not going to have students anyway. So we need to look at how we can leverage this idea, how we can address both to provide, like I said, a safe, healthy environment that is both economically sound, but also has those safety measures in place that supports the entire campus community. But with that being said, I don't care who I'm talking to, I'm going to stand by this, that the public health of your campus community has to be priority, has to be. And I think for far too long, I think a lot of us can attest that the health and well-being of our campus has not always been placed at the top of the priority list when it looks at campus priorities. Sometimes, depending on the school you're at, sports, athletics might be priority. If you in the MEAC, then sports probably not priority because the MEAC, y'all struggling a little bit. I'm pretty sure some MEAC people about to jump in the comment section. But if you in the SWAC or the CIAA, then we know sports is supreme. And I'm saying that because I'm a CIAA alum. So if you're in the MEAC, then you probably don't care about sports because, I'm joking. I love the MEAC. But the public health of your campus has to be priority as you look at these guidelines and as you try to determine what you're going to do. So why? Like, why do we have HBCU health? Why do we have to have these focused conversations? Why is it that when people come together, we want to focus on one in particular group over the other? It's not about that. It's about, like I said in my introduction, it's creating a centralized, focused approach for a set of tools and resources that support the unique needs of HBCU students, both their health and well-being on campus and off campus. Because as we know, there hasn't really truly been a centralized effort. When you look at different college campuses, and we're going to talk about a few today I'm just going to name a few, North Carolina A&T, Tennessee State University, Clark Atlanta, Spelman, Texas Southern, Prairie View A&M, Hampton University, Norfolk State. A lot of these colleges have started putting out reopening plans, and it makes you not necessarily question, but when you're looking at these plans, a lot of them have similarities, but a lot of them have differences. And some of those differences aren't always grounded in what's the national best practice for what the university should be doing. And I'm not saying any of these practices are wrong based off these universities, because each university has unique needs and they have to focus on, what are their state guidelines, what are the regulations that their cities have put in place. But when we look at a centralized effort, I think that's where the message is getting lost. Because if you have a campus, whether it's a state part of a state university system or a private institution, but they're operating in the same state and they're doing two completely different things, then that begs the question, how effective can your campus policy be when you're looking at reopening? For example, the University of North Carolina system that houses several colleges and universities across the state of North Carolina. If they're planning on reopening 100% in the fall, but then you have colleges and universities that are private in the state of North Carolina that aren't operating on campus in the fall, how then do you mitigate the transfer of students from one campus to the other? If I'm a student and my campus is 100% closed, but I need to use the library and I can go to this open access campus that's completely open, how then are you mitigating the transfer of this virus, which is ultimately what we're trying to do? So like I said, that's the benefit and the purpose of us having these conversations. Our past webinars is why I thought it was important to create something like HBCU Health, because it's important that we have these conversations both from a candid perspective, but also from a very focused perspective that takes into account the cultural differences and the significance of the background of these students that come to these institutions, as well as the nuances that exist across our HBCU campuses, whether it's the resources that are available, whether it's the cultural norms, whether it's the historical significance. These are all things that go into account when we're talking about how to develop reopening plans and how to support the health and well-being of our college students on campus. I wanted to first talk about COVID-19 and the virus itself from a standpoint of what we don't know, as well as what we factually do know. Because like I said, there's a lot of misinformation that is still floating around today about this virus. And if you look at the news or you look at different sources, if they're not evidence-based or these aren't research-focused areas, if Facebook is the primary source, or Instagram or Twitter is the primary source that our students are getting their information from, or that the parents of these students are getting their information from, or if it's these 24-hour news cycles, depending on the channel you're watching, that you're getting your information from, we all know that information can be biased. So that's why it's so important that we, as healthcare professionals, when we're developing our communication for our students, when we're advising our campus leadership, that we understand from an epidemiological standpoint what we actually know and what we actually don't know about this virus. So what we don't know. Well, as of today, we do not know the true case fatality rate of COVID-19. What is that? If you catch COVID-19, how likely are you to die? Now, we can look at the number of people that have caught it, the number of people that have passed away, the number of people that have recovered, but to truly know the case fatality rate, like we have done with several other viruses in the past, whether it's SARS, whether it's the seasonal flu, whether it's HIV, we do not know the true case fatality rate of COVID-19, which is very dangerous, because if you can't factually tell somebody your chances of survival if you get this virus, how then can you expect thousands of students, faculty, and staff to feel safe about coming on campus when you bring all of these people together if I can't statistically and factually say whether you will live or die if you get this virus? But also what we don't know, how exactly is COVID-19 transmitted? We do know that COVID-19 is transmitted through droplets in the air. So if somebody sneezes, somebody coughs, somebody wipes their eye, wipes their nose and touches a surface, we know COVID-19 is transmitted through droplets. But what about aerosols? How long does COVID-19 last in the air? We do know that the COVID-19 virus is a heavier droplet, so it doesn't stay in the air as long as the seasonal flu. Seasonal flu tends to stay in the air a lot longer, so that's why it's so contagious, because if somebody sneezes in a closed environment, that seasonal flu is a light aerosol, so it'll stay floating around the air for a longer period of time. Whereas COVID-19 is a heavier droplet, so it tends to fall to the ground a lot quicker than the seasonal flu. But what about aerosols? What about fomites? So when we talked about surfaces, if somebody sneezes in their hand and they touch a keyboard in the library or in a residence hall, if they, use a community bathroom on the hallway and they're touching different surfaces, how long does COVID-19 actually live on that particular surface? Nobody can answer that to 100% factual information. We do know that COVID-19 does live on surfaces, but for how long and what type of surface? Does COVID-19 live on cardboard? Does it live on metal? Does it live on plastic? How long? And these are questions that we're also going to have to ask, because all of those substances are on our campus, all of those surfaces, especially our community areas, our student centers, our recreational centers, our campus health services, our residence halls, our libraries, even just our offices, even some of those student offices like financial aid, the registrar's office, offices that students frequent the most, and they're contacting these surfaces. We don't know how long COVID-19 actually lives on these surfaces. What else don't we know? We don't know what actually works to treat COVID-19. Does anybody know? I don't know what actually works to treat it. We do know that if you're unfortunately to the point where you contact COVID-19 and you have underlying health conditions, or you're at risk, higher risk factors, and you have to be incubated through a ventilator, we do know people that go on ventilators tend to recover. But what is the actual treatment for COVID-19? If I am a young 30-something-year-old adult and I contact COVID-19 and I test positive, how do I treat that? We don't know, because it shows up different in everybody. How effective are all those face masks actually? I think that's a great question, because face masks are popping up everywhere, from face masks made out of old t-shirts to the N95 mask to a mask somebody, grandmama, aunt, cousin, great granddaddy, best friend, sister done took and stitched up and put a nice little bedazzled logo on the side. We don't know how effective all of these face masks actually are. We do know that it slows down the transmission of those droplets. So if you do sneeze or you cough, or even when you talk and those droplets come out of your mouth, we do know that that barrier does prevent that virus from spreading further than the 6 feet that they say is the required distance. But how effective are those masks actually are? Is one fabric better than the other? We do know that if you make a face mask and you use material that is non-absorbent, and as you talk, that face mask gets wet, and then you do happen to come in contact with someone that has COVID-19 and those droplets contact that face mask, what do you think is going to happen with those droplets that come in contact with your wet droplets on your mouth that's still contacting the part on your face? So these are questions that we have to ask when we're giving out recommendations, when we're telling students about this and about that. These are things that we just do not know factually to be true. And the last one is, how long does immunity actually last? We don't know. So if you have tested positive for COVID-19 and you recover, how long will it be before you can get it again? Can you get it again? Will it be worse if you get it again? There have been cases popping up all over the world where people have tested positive for COVID-19 more than once. There have been several stories and several studies that have come out where COVID-19 is now morphing or transforming into a different viral substance to begin with. So these are all of the questions that are plaguing public health professionals. I'm pretty sure you all have had some of these conversations on your campus, but these are things that we just do not know effectively today from a factual standpoint about COVID-19. So with that being said, what do we know? Well, we do know that in order to decrease transmission, which is from the virus transmitting from one person to another, we need these 4 things. We need social distancing, testing, contact tracing, and adequate PPE, or protective personal equipment. Those are the 4 things we know that will decrease transmission. Notice I didn't say it decreases your chances of getting COVID-19. It just decreases the chances of the virus being transmitted from one person to the other. We do know that these things will decrease that. It's not 100% fail-proof method where if you do all 4 of these, that won't happen. but we do know that these four things will decrease transmission. Social distancing, very difficult to do on a college campus. Testing, even more difficult to do on a college campus because of the lack of testing available. Contact tracing, something that is a novel idea that most states haven't even effectively put into place. I'm in the city of New York, in the borough of Brooklyn right now, and our state is just over these past couple of weeks starting to put in a contact tracing program. And I think it's important that as you develop your reopening plans and as you talk about what does that look like if we do bring students back on campus, you definitely want to consider having some type of contact tracing program in place. So what is contact tracing? Contact tracing is when you have the ability to trace where somebody who was infected and all the contacts that they've had. So if you have a student that, if you just, let's say you do decide to open or your college decides to open for operations in the fall, and after 2 weeks on campus, a student comes into your health center and they have, a fever, they've lost taste, smell, they can't focus. You are able to test them. The results come back. The student has tested positive for COVID-19. But keep in mind now that you're not going to get those results back right away. Most time frames for results to come back on a COVID-19 test, I think, is down to like 2 or 3 days, maybe 4. So within those 4 days, this person could potentially still be walking around your campus positive for COVID-19. Now, before this student came into your student health center, they were in their residence hall where they have a roommate. And when they woke up that morning feeling ill, they didn't just come straight to the student health center, because students never just come to the health center when they're feeling bad. They wait until they're on their deathbed, then they come. And you ask them, well, how long have you been feeling like this? And they say, about 3 days. And you say, why did you wait 3 days? That sound familiar, that conversation? You heard that before? That's usually what students are going to do. So if this student comes into your health center, you can imagine they probably have been having these symptoms for several days, which means they probably have went to the cafeteria and gotten something to eat on those days. They might have used the library. They might have worked out in the gym. So now this student that has tested positive for COVID-19 on your campus has been in contact with several different locations, has been in contact with several different people. So now this contact tracing program has the very important responsibility, and some would say the very insurmountable responsibility of being able to trace where this student was at over those days, essentially 14 days. That's how long they say the virus is symptomatic. But essentially, you have to now trace to see where this student was on your campus over these past days. And that is a very difficult task. But in order to decrease transmission, there has to be some type of contact tracing program in place. And when you're discussing your reopening, when you're planning on, what does that look like? One thing I think a lot of our colleges fail to do is to be proactive. We are very reactive. That we know how to react. We know how to some do this way. We know how to go that way. But in this case, you have to be very proactive. That's why I think it's so important that we are having these conversations now, is because the fall is going to be here. Students are already making those decisions about what they're going to do in the fall. And colleges should be too. And that's why it's so important that as we move through this COVID-19 pandemic, as our colleges get more and more clearer about what it's going to look like in the fall, as we even get a better understanding about what this COVID-19 virus really is, colleges have to start putting these proactive measures in place, and especially HBCUs. And can I be transparent here? Like, I'm an HBCU alum. I worked at 2 different HBCUs, so I feel like I'm invited to the cookout now. So I think we can all have these conversations. We as HBCUs probably don't do the best job of being proactive, do we? We don't probably have some of the best measures in place of being proactive. And I could be wrong. Like, I could be wrong. If you are from a college and you say, nope, we are proactive, that's part of our motto, that's part of our school song, to be proactive, then I will stand corrected. But in my experience of working with different HBCUs, and not just HBCUs, colleges in general, being proactive is not always at the top of the list of things to do. Contact tracing is a proactive measure. It's putting a program in place that allows you as a healthcare professional, as a college, to be able to react and trace if a student does come positive. Because the last thing you want to do is have your health center be in a position where a student comes in and they test positive and you have no plan in place. What do you do next? If a student comes into your student health center with a positive result, what is the very next thing you do? And we're going to talk about that a little bit as far as developing policy, but what do you do? So developing some semblance of a contact tracing, whether it's just a minimal, whether it's large scale, there's a whole department. Depending on your financial needs, I would definitely encourage you as a healthcare administrator on campus to definitely start having this conversation with your campus leadership about uh, allocating funds, resources, time, effort, part of your policy, your reopening plans of having some type of contact tracing. And not only would that support those students that are on campus, but that would also give those parents that are considering bringing their students to your campus some type of comfort to understand that, oh, this college is actually understanding what some of those public health recommendations are, and they're putting something in place that if a student does test positive, I want to make sure that my child is protected. So please think about putting some type of contact tracing program in place. And Johns Hopkins right now on Coursera, and I'll add this link as well, they have a free course right now. I want to say it's like 13 hours, and there are videos, there are tests, there are recommendations on everything about contact tracing. That's on Coursera.com, and it's developed by a faculty member from Johns Hopkins, and it's free. I would encourage you to definitely take advantage of that course. Also recommend that to your staff and even to all administrators on campus, because that walks you through what is a contact tracing program. It tells you the background, it tells you how to develop it, tells you what that program should look like. It even gives recommendations on developing small scale all the way to large scale program. It doesn't have to necessarily be 20 people working on this. The more the better, of course, but you at least want to have something in place that addresses what would happen if a student does come in contact. So secondly, what we do know, well, we do know that if we increase on this list, number 2, 3, and 4, then 1 is not so necessary. Those that 1 and that 2 right there, what we do know number 1 and what we do know number 2 is the most important thing that you can take away from what we know about COVID-19. The 4 I said are social distancing, testing, contact tracing, adequate PPE. But if we increase testing, increase contact tracing, and increase the availability of gloves, face masks, hand sanitizers, then social distancing is not so necessary for so long. The United States of America has surpassed 100,000 deaths from COVID-19. We are number 1 when it comes to a number of infected people in the world. Second behind us is not even close, not even a close second. There were several countries that started or had their first case at the same time the United States did, and they have almost completely mitigated their numbers of infected people, whereas the United States of America is still going up. Some states have flattened that curve, but there are several states across this country where we're seeing numbers increase on a daily basis. And most of those states where those numbers are going up is where most of our HBCUs are located, in the Southeast: Alabama, Georgia, North Carolina, South Carolina, Florida. Those are the areas where we are still seeing increases in cases, unfortunately. We do know that one infected person in close contact with a large group can greatly increase spread, which is very important on a college campus, whether you have a campus with 1,000 students or a campus with 10,000 students. Students congregate in small areas, whether it's a residence hall, whether it's a dining facility, whether it's your student health center, even whether it's outdoors on the quad or whatever you call it, where your students congregate on campus. These are areas where one person that's infected can infect several people in one go. So when we're talking about reopening and limited access to certain areas, this is going to be very important to slow that spread, and we close off some of these areas and don't allow some of these groups to congregate together until we are able to, like I said, understand a little bit more about COVID-19. And the last one I think is very important about what we do know, because it impacts students from this demographic and their family members most significantly, is we do know that pre-existing conditions and health disparities significantly increase risk factors and the possibility of death. I think as the data continues to come out about the number of people that are affected across this country, number of people that are dying from this disease, we already know is disproportionately impacting communities of color, especially African Americans. And as we know, over the 200,000 students that attend the 100 HBCUs across this country, the overwhelming majority of those students come from these communities that have been impacted the most by COVID-19. So on top of reopening your campus, on top of creating a safe learning environment, on top of making sure that faculty and staff feel safe, now we're going to have to deal with the post-traumatic stress that's come from our students that have been impacted by this disease while they were at home, or have lost family members, or have died themselves, or have gotten sick and have experienced what it's like to have that disease. So these are all things that you have to take into account as you're moving forward to create your reopening plans across the country. So I want to give a chance for if there's any questions or comments that you want to add, please feel free to continue to use that chat box. So what are some challenges for our HBCUs with reopening? What are some of those challenges? Those four, I think, are the most important challenges that we face as historically Black colleges and universities: our messaging, our process, our ability to create safe environments, and the financial strain that this is putting on all of our institutions that are already historically underfunded. So how do we adjust or how do we adapt to address these four areas of challenge? Well, messaging. We have to create thoughtful yet accurate information that is consistent and reaches the right stakeholders. When we put out messaging, a lot of times that messaging does not get to our students. How many times have you heard students say, well, I didn't hear this, I didn't get that, I didn't know they said that? Now more than ever, we have to make sure that our messaging that is going out about our reopening plans, about what our colleges are doing, are consistent. And you as the healthcare professional have to take the lead in this communication. You have to make sure that when communication goes out, that your staff, your administrators, those individuals that have that public health background, have that healthcare background, are involved in that messaging and is ensuring that that message is getting to the right people that it needs to go to, and that is thoughtful yet accurate. And I put thoughtful in there because we don't want to lose the fact that we are communicating about a public health pandemic to our students. And like I said in that previous slide, our students are the ones that have been impacted the most. Like, think about that. A global pandemic that is killing hundreds of thousands of people across the country. African Americans are leading when it comes to the number of deaths attributed to this virus. So think about that when you're sending your messaging out. You don't just want to be cold and direct and just talk about the logistics and the planning and got to get back to this, got to get back to that. Make sure that your messaging is including some thoughtful language that you understand, that you can relate, that you have supportive measures in place. You want to make sure that your messaging, although it does talk about reopening and what your university does plan to do from a logistical standpoint, you also want to make sure that this messaging is human, because you're not sending this message out to robots, you're sending it out to humans. You're sending it out to students who are in this boat that don't know what to do next, that are dealing with anxiety, that are dealing with stress, that are dealing with the uncertainty of what the future holds for when they will be able to return to campus. Process is a challenge. We have to commit to a plan that places health first, and it's fluid to adapt as new information arises. A lot of these reopening plans that colleges and universities are putting out, whether it's HBCU, whether it's a PWI, even though those plans have phases, they have benchmarks, those plans still need to be open to change, because as in new information comes out, as data changes daily, as knowledge about this virus and how it impacts people changes, as recommendations change that come out from the Center for Disease Control, the American College Health Association, the American Council on Education, as these organizations continue to adapt and be fluid in how they send information out, it's important that your information adjusts and adapt and change. So when you send out information to your students, you want to make sure that there is some type of disclaimer, some type of message in there that lets them know that this could potentially change, both one from a legal standpoint and also from a messaging standpoint. Because like I said, there's so much we don't know about this virus. How can your messaging be 100% solid and say, this is it, this is what we're doing? Even when it comes to reopening dates. I know a lot of colleges and HBCUs, some of our members that are on this call right now, your college has given a date. They say, we're going to open August 15th. That sounds really good, but more than likely that might change. And if it doesn't, your messaging has to be open to interpretation for change. You still want to be directing your messaging. You still want to, be based in fact and be thoughtful, but you want your messaging and your communication plan and your process of how students and faculty will come back on campus. You want that to be fluid and be open to interpretation. So depending on the language that you want to use when you're sending out information, whether it's email, whether it's via social media, whether you're just in a board meeting with your senior staff, you do want that message or that messaging to be open to change. So I would definitely recommend that when you send out your plans, when you post on social media, there is some type of messaging in there, some type of statement at the bottom, somewhere on the side, something that just says that all the plans here are open to change, because that goes back to being thoughtful. Are fully aware of the changes that are daily happening with this virus, and that your messaging will change and will adjust based off that information. Because if new information comes out next month that says something completely different than what we're doing today, how then can your plan still be in place and still speak to what you were planning on doing a month ago? safety and financial are two big challenges for HBCUs as well. It's important to leverage campus resources to effectively implement a campus safety plan that one minimizes risks and is least impactful on academics. We have to keep that in mind that we are colleges and we are institutions of higher learning, which means our ultimate goal is to educate our students, but also create a safe and effective learning environment. You have to take the whole environment into account when you're putting these plans together. The academics is the priority to ensure that our students still have access to their academics. But now more than ever, technology has opened up that door to show us that students can learn virtually. Although it might not be the best course, students can learn virtually. So keep that in mind, that as you're making these decisions, as you're informing your senior staff, that is still an option. It might not be the best option for students in their minds, but like I said in that first slide, public health safety of your campus should be top priority. And then lastly, financial. Simply put, I don't think it's any secret that we know HBCUs are usually in a situation of financial strain and don't always have the most resources to do what needs to be done. But this comes down to a question of health outcomes versus economic stability. And I think when you look at the decisions that your campus is making, you can ask yourself that right now. Those of you that are involved in these conversations, those of you that are in these boardrooms or in these senior staff meetings, you look at the language, look at the verbiage, look at how these conversations are going. Is it the health outcomes being a priority, or is it the economic stability of this campus being a priority? And those two can go hand in hand. Like, they don't have to be separate from each other. You can do both. Like, you can have a strong system in place to support the health outcomes and ensure your economic stability of your campus is taken care of. Like I talked about virtual learning, that's still an option. I don't think we have to rush back to campus just because that's what's most fiscally responsible or most fiscally in need. Now, of course, I want to get back on campus. Like, I don't think it's anybody's secret, or we aren't going to disagree that getting back to campus, having those things in place is what we really want to do. That's what we want to do because that's what's best for us. And that's definitely what's best for our students. But like I said, as we're making these decisions, we have to take all of these challenges into account and ensure that these policies, these communication measures that go out, these decisions that are being made are in the best interest of our students' health first before anything else. I was just pausing to see if there were any other comments that might have popped up. There was a poll done by the American College on Education. This was done on April 29th that looked at 96%. They surveyed about 200 college presidents, asking them about their concerns about fall enrollment. And 96% of those college presidents said they were concerned about fall enrollment. So that's almost 100%. So we aren't the only ones as healthcare professionals that are concerned about what that fall enrollment looks like. But the best way that you can support fall enrollment and to ensure that you have fall enrollment is to make sure you have a sound plan to support your students if they do return in the fall. And even if students decide not to physically come back on campus, you still want them to enroll in your college in the fall. And you do that by making sure your messaging is sound, is thoughtful, is complete, and is transparent. Messaging is huge right now because really that's the only way we can communicate as healthcare professionals is through our messaging, through email, through social media, through contacts, whether it's virtual, whether it's through Zoom. This is the only way that we have to communicate with our students and with our stakeholders right now. So the messaging that you are giving out, the way your website looks, how you're communicating, how frequent you're communicating is what's going to be the difference between whether you have fall enrollment or not. Because if I'm a college campus and my campus isn't putting out anything about what's happening, if I go to their social media and they're not having any information about what's happening in the fall, if I can't go to the website and see any videos or any updates, if I'm not getting any communication via email, if I just got one email when campus closed and I haven't heard anything since then, how loyal do you think those students are going to be to a college campus that isn't communicating with them on a regular basis about what's going on? Even if it's not a brand new update, you still, even as a student health center, you still want to be engaging with these students throughout, offering them support, letting them know you're available, providing your phone number, providing your social media handles, engaging with these students on a regular basis so they know they are not alone. They know that they are here. They know that they are here on where this is at. What can you do? A lot of you have already created a COVID-19 task force on campus. If you have not, I would definitely encourage you to do that today. COVID-19 task force is very important to have because this is the task force that essentially makes the decisions or is involved in the messaging that goes out. I think a lot of HBCUs have put together COVID-19 task force, but if you haven't, I would encourage you to today because this is a group of individuals that is a collective group of individuals from across your college campus that is making those decisions about what your campus is doing. So here I just listed 3 different considerations that your COVID-19 task force should focus on. 1 is student support, 2 is campus environment, 3 is the safety of your faculty and staff. So when you're developing this task force and you're trying to determine or define, what is our task force going to do? What are going to be our main focus areas? This is what will be my recommendation for what your 3 focus areas should be. Because when you create that task force, you want to have some type of mission. You want to have some type of expected outcome that when you go meet with your campus administrators, when you are communicating to students, you want to have some type of pillars or some type of guiding force that determines the direction that your task force is going. What type of work are you doing? What are you going to do? Are you going to just get together and talk about all the problems? Are you going to be effective in your communication? Are we going to put forth plans? Are we going to have recommendations? What is our task force going to do? So these are the 3 pillars or the 3 areas that I would recommend that as you're shaping this task force, if you haven't already put one together, or if you do already have a task force, I would encourage you to ground that task force in these 3 areas because these 3 areas are going to be the main 3 areas that are going to be determined about reopening. It's going to be the main focus of supporting your students, of supporting your campus, actual physical environment, and then of course supporting your faculty and staff so that way they feel safe when it's time for them to come back on campus. So under here, I just listed some different offices on campus that you should consider of involving in this conversation. So when you are putting this task force together, you want to make sure that you have representatives from these different groups because they're going to give you different perspectives and different feedback from their areas and the challenges that they face, as well as a different viewpoint. So when you're looking at student support, of course, you want to have representatives from student activities. You want to consider Greek and sorority life, fraternity and sorority life, and the Greek life. And these can definitely be students. I think a lot of times what's forgotten about is student input. When these task forces come together, when our presidents put out information, when we put out reopening plans, and just think about some of the plans your college has put out, how much student involvement and how much student input went into what your campus is putting out. Because if that's your primary stakeholder, your student, why then do we not have students involved in this decision making? I'm not saying you have a task force made up of students and they're the only ones making decisions. I'm saying you have some type of student leaders that are on these task force that are helping to provide the voice of what the students' wants and the students' needs are. Because if you have a room full of administrators and you're all making decisions that you think is in the best interest of the students, but you haven't consulted with a student, and then you put out all of these, recommendations and reopening plans that had no student involvement, you probably aren't going to have the support of those students when it comes to following those guidelines. So definitely when you're looking at recommendations for student support or policies for student support, these are some examples of the departments you want to have involved in that decision-making process. Of course, when it comes to campus environment and actually the physical environment of your campus, I think it's very important that residence life representatives, whether it's your director of housing, your vice chancellor of residential life and housing, whoever is your senior administrator, when it comes to your residential life and your dorm and your campus facilities, residential facilities on campus, it's important that somebody is represented on that task force from that group. Because a lot of you have residence halls on campus and they're considering reopening. They're considering allowing students to come back in those residence halls. So what does that look like? Do you have an entire 100% occupancy? Do you have certain floors that aren't open? Do you only allow so many students to one room? Do you skip rooms and leave rooms open? Do you dedicate one of your dorms to be a quarantine dorm? That's something to consider. Where if you do have faculty or staff or students that test positive, where are you going to place those students until they're able to get further medical treatment and be removed from campus? So these are all considerations that you have to take into account when you're making decisions about campus environment. Of course, facilities, public safety, and lastly, athletics, because a lot of us have athletic facilities and there's still decisions being made about what athletics is going to look like in the fall. But you want to have individuals represented on that task force from all those areas to help provide input and information and feedback on supporting a safe campus environment. And then faculty and staff safety, of course, you want to continue to involve your public safety office. Academic affairs should definitely play a part in this because they're going to provide that feedback and the best practice and understanding of how to deliver instruction. Your provost, deans, and then of course representatives from human resources can talk about some of this faculty and staff wellness initiatives that can be in place to support those faculty and staff that are on campus when they do come back. So this is just a breakdown to talk about, like I said, how your task force should look, as well as some pillars or some different things that you should have on that task force to ensure that you are creating a comprehensive and concise organization when you're putting that task force together. Phases of reopening. A lot of colleges have put reopening plans together, and best practice from what I've seen with research and looking at different colleges, both HBCUs as well as predominantly white institutions and minority serving institutions, is most of them are planning their reopening in phases. It's not just we open in the fall and everything's a go. They're opening in phases. So here I listed some recommendations that you should consider if you are reopening, or if your college hasn't already put these phases in place. These are some best practices or some recommendations that you can look at when it comes to a phase reopening. And when we say reopening, that doesn't mean essentially come back on campus. That's just reopening where you can allow certain essential staff back on campus, whether you can have a hybrid model where some courses are taught on campus with limited student involvement and still taught online. This also doesn't have a date, if you notice, because the reopening determination is going to be based off your individual campus, your individual state. Some campuses have decided to open early and in early before fall break. Some campuses have decided to just completely reopen. Some campuses are still making a determination whether students will come back on campus or not. So this right here, just to give you an idea of what a phase of reopening should look like. And it's just a timeline. Phase one, it should be limited access. This is where you have to define your essential staff. Who is a part of that essential staff group? Student health and counseling should continue to be accessible. I know from our previous webinar when we talked about mental health service delivery, and the representatives that we had on that previous webinar from Tennessee State University, Howard University, Alabama A&M, Wiley College, all of those institutions were still offering telehealth support to their students during the summer. I know if this was a normal environment, a lot of times those student health plans or the way your campus self-services are delivered, a lot of services aren't available to students during the summer. But I would encourage you that if you have not already made this decision, to find some way to make it possible for your services to still be offered to students during the summer. Because essentially they lost half of their spring semester. So one way to get around that or to make that argument stronger is that if you have a student health plan and your students pay for a fall semester and a spring semester, essentially that spring semester was not done in person. So I would definitely have a conversation with your student health plan provider and see about working that out where you can provide some type of telehealth support services for your students throughout the summer, because they're going to need it. And this is a great way to stay connected with your students throughout the summer as well. Also to keep in mind with telehealth, and I think is my screen still sharing? Yeah, it is. Just want to make sure. Let me go back. Also, when it comes to telehealth, keep in mind that there are three different types of telehealth. You have telemedicine, and you have telehealth, and you have telemental health. Telemedicine is where you actually have your students meeting with a primary care provider on health-related issues. So if you need a prescription refill, if you need a physical done online, if you want to talk to a doctor and follow up on reproductive medication, if your students are receiving that, that's what telemedicine is. Telehealth is more of a health promotion delivery service. So if you have a student that wants to talk to your wellness professionals, if you want to talk about diet and exercise, if you want to talk about ways to manage stress and anxiety, that's what falls up under your telehealth services. Telemental health focuses directly on delivering services from a mental health provider. So you have telemedicine, you have telemedicine, you have telehealth, and you have telemental health. So keep that in mind that as you're determining what your virtual service is going to look like, and as you're working with your student health plan, trying to define these for either reimbursement, for payment models, even when it comes to delivering these services across state lines, that's something else you have to consider. If you have students that are on a student health plan that usually covers that student while they're on your campus in that state. But if you have students that are out of state, you want to make sure that when you deliver these telehealth services, for example, if you're in the state of Maryland and you have a student that lives in Virginia, you want to make sure that your telehealth service student health plan actually covers the delivery of those services to a student in a different state. So this is what you really want to consider when you're delivering those services. And that usually only comes into account if you have services that are getting reimbursed from a student health plan or outside insurance policy. If you don't have a student health plan, if your services are provided free of charge, then you still want to look at the license requirements of your medical or your healthcare or your mental health providers. So if you're a licensed mental health professional, or if you're a licensed medical provider, you want to look at the licensure requirements and the considerations that go into delivering services across state lines. I know the FCC and the Center for Disease Control, a lot of those governing agencies have eased some of those standards during COVID-19 to deliver those services. But before you really get into a new counseling relationship, or you do treatment plans, or you prescribe medication to your students, make sure that your licenses allows you to deliver those services across state lines. And again, 3 different types of tele options: telehealth, which is strictly clinical medicine, telemedicine, and then I forgot to tele, I said some tele so many times, telehealth, telemental health, and telemedicine. You want to make sure that you are defining those 3 when it comes to how you get reimbursed. Of course, during this phase 1, you want to suspend all on-campus events. I don't think that's any secret. And then, of course, during this time, campus communication should be frequent. So keep that in mind, whether this is a just checking on you how you're doing, whether it's a message from your provost, whether it's a message from one of your counseling staff, whether it's a student. Keep in mind that when you are delivering these services, whether it's through social media, whether it's through email, think about having a student do this. There are several colleges that HBCU Health has worked with on Instagram that does Wellness Wednesdays events, that does events where they have Q&A sessions and they brought on student leaders. So think about if you have a student health organization, try to connect with them virtually and involve some students in those conversations. So that way, when your students are seeing this messaging come out, they see students delivering the messages and not always healthcare professionals. So these are just some of the other phases, and I'm going to kind of move through this a little bit quickly because we're coming up on that 1 o'clock hour, and I did want to leave a little bit of time for questions and feedback. But these are just some other phases you want to look at as you are putting your reopening plans together. Phase 2 usually covers increased access with remote work. And this is where essential meetings can happen in person, but they're limited. You want to implement randomized testing of COVID-19. And this is something that I know a lot of our, some colleges have started already having these conversations. This is going to be challenging, but there are some colleges that have started working with outside testing agencies as well as their public health departments to implement some type of randomized testing for COVID-19. Now, of course, you can't force anybody to get a COVID-19 test, but you can put, when you're developing your policies, certain requirements in place that for the health and safety and well-being of our campus, there could potentially be times where we will do randomized testing of COVID-19. I would encourage you to refer to the University of Alabama at Birmingham. They actually just put out a very comprehensive report on reopening, and they discuss in a little bit of detail about how they're planning on implementing randomized testing of COVID-19. This is something you definitely want to involve your legal counsel on when you're having this conversation, but the benefit and the purpose of doing this is because individuals can be asymptomatic, which means individuals can essentially be carrying COVID-19 and not even know they have it. So by doing randomized testing, it allows you to essentially catch those individuals and prevent them from potentially spreading it or continuing to operate on campus. But like I said, this is something that will probably come with a lot of challenges, especially on our campus, but it is something to definitely consider or look more into to see if it's something that your campus would be willing to adopt. And then lastly, phase 3, which can be expanded, but this goes out to looking at modified access. And I put modified because modified can be defined by your individual campus. And this is all based on climate. So if you're in a state where a number of cases is continuing to decrease, if you're having your COVID-19 task force meetings and you're starting to see more positive results, then this is where you can start looking at more modified access. And these timelines should always be flexible. And I put only after a contact tracing program is in place. Because remember, we talked about contact tracing being a proactive measure. So I would encourage you to have some type of policy, protocol, something in place that talks about contact tracing before you open up and move to phase 3. Because the contact tracing piece is the proactive measure. And if you don't have a proactive measure in place, it's going to be very challenging to then move forward and allow people to come back on campus. This is where you have phase staffing. So if staff are allowed to come back on campus, you can look at a phase model where you have certain offices where you might have, certain individuals work Monday, Wednesday, Friday. Certain individuals come in Tuesday and Thursday. You have flex work schedules where, some individuals work mornings, some individuals work afternoons. So this is where you can start kind of looking at different ways of having individuals start to slowly come back on campus. Quarantine site on campus. When I talked about residential halls earlier, you definitely might want to consider having some site on campus that is considered a quarantine site, where if an individual does test positive or several individuals test positive, you can actually move those students or even those faculty and staff to those quarantine sites until you're able to evacuate them and move into a treatment facility off campus. And then lastly, I mentioned this earlier, but like I said about Johns Hopkins on Coursera.com, that's Cousera.com. Johns Hopkins has put together a COVID-19 training program. But I will also consider having and working with your human resources department to implement some type of COVID-19 training and make it mandatory. A lot of times when we do our opening sessions or we do our faculty and staff retreats, these trainings and these programs are mandatory. So why not put together, some type of COVID-19 training that educates your faculty, your staff, your students on COVID-19, similar to what we're doing today, and even educates them on the policies and the protocols that are going to be in place moving forward. And I would recommend partnering with your human resources department because they'll be able to help facilitate and work on delivering that to all your faculty and staff. So effective campus policy. This is something that I just wanted to add a couple pieces on when we're talking about what does that policy look like. Because you are going to have to put some type of campus health policy in place. And a lot of you, whether your health center is already accredited or whether it's not, you should already have some type of policy and procedure manual that governs what you do in your student health center. You also, if you haven't, should have some type of emergency procedures that your campus has in place, not just to respond to public health crisis, but everything from active shooters to bomb threats to weather emergencies. This is where you want to implement that campus health policy. So this is not nothing you necessarily have to create from scratch, but it's something that you want to add to those policies and procedures that are already in place. You want to add addendums to that because a campus health crisis is essentially the same as those other campus emergencies that we're talking about, whether it's weather, whether it's active shooter, whether it's bomb threats, any of those campus crises that can happen. Now we know that a public health pandemic definitely needs to be a part of that policy. So this is just some measures or some recommendations that you can put in your campus health policy when you're developing it. And notice the first one that I put on here was that it should be facilitated by student health services. And I wholeheartedly believe that when you are talking about health policy, you want to have individuals with a health background leading that development. And when we're talking about facilitating, we're talking about the language that goes into that policy, what sections are in that policy, how it's structured, any revisions that are made, and then how it's disseminated across campus. Is it done where you put your policy out and it goes online once a month? Is there a session where you update it regularly? Are there addendums that are made? Who makes those revisions? But you want your campus health center to be the sole individuals that own that policy. When I say own, that means that you are the ones that have that master copy. So if there are any changes that are done to this policy, if there are any updates, if there's any information, if there's any additional sections or structure that needs to happen to that policy, some representative from your campus health center is responsible for putting that policy together and ensuring those changes happen. Because I'm pretty sure we all can agree that there have been policies that have went out and been written, and it's been 20,000 people that have written that policy and nobody can find the original one. So make sure that when you're putting these new policies together about reentry, about returning to campus, about what happens if somebody tests positive on campus, that your student health center, if you don't advocate for nothing else during this time, this is what I would strongly recommend that you advocate for, is that your student health center are the primary owners of this policy when it comes to writing it, when it comes to revising it, even when it comes to determining how it goes out and who it goes out to. Because keep in mind, there are going to be several different types of policies, and probably three. You're going to have an internal policy that's usually only seen by individuals on campus. That's going to be very structured. That's going to be very down to the wire. That's going to be an ABCD policy development. You're also going to have another version of that policy, not a new one, but another version of that that's written more in plain language, that's for your student body, because your students don't care about all some of the ins and outs that goes into the policy that's written for your faculty and staff. And then the third one is going to be a version of that that's more simplified that can be put out to the general public. So you're going to have three different versions. You're going to have one that's your full detailed policy, that's usually the longest one, that speaks on everything from the background of the virus to what your campus is doing, to internal structure, to response, to how a person is isolated in quarantine, to the time limit that they're responded, to who responds. That's how detailed your campus health policies to be for your campus constituents, such as faculty and staff. The other version is going to be a less detailed policy that's easier to understand and that's written in a language that your students can understand. And this is going to highlight the information that's important to students. And then the third version is going to be the one that goes out to the general public. Now, you can make all three of these versions available, but you want to make sure that the individuals or the stakeholders that you're writing that policy for, that it goes directly to them. So the one that's for the student, you definitely want to make sure that all of your students get access to that. The one that's for your entire campus or your faculty and staff, you definitely want to make sure your faculty and staff have access to that. Faculty and staff can still access the student policy, but you definitely want to make sure that when you send this policy out, whether it's via email, whether it's on social media, whether it's your website, you want to have different links. So when you update your website and you have your new campus health policy on COVID-19, I would recommend having three different links. One that says for students, one that says for faculty and staff, you can put parents on there under the students one, and then one that says general public. The general public one is going to be more of a bulleted list that talks about what are we doing, how are we doing it, and then how are we going to respond and who's going to respond. Takes me to my next point, include response measures. You can't have a policy without saying what you're going to do if something happens. So in the event something happens where a student tests positive or a faculty and staff member tests positive, this is essentially the who, what, where, and the how. The who, who's going to respond? Who's responsible? Is it the health center? Is it the vice president? Is it the provost? Is it the vice chancellor? The what? What is the cause? What are we going to do essentially? What are we going to do? If a student comes in, the example I used in the beginning, and they test positive, what are you going to do from that moment moving forward? The where do you isolate these students? Where do we place them? Where is the testing done? Where do we send the results of the test? And then the how are we doing these things? How is this going to be executed? Is it going to be a collaborative between our student health center and our counseling services? Is it going to be something that our student affairs department gets behind? So when you're putting policy together, these are the 4 points you always want to address. It's the who, the what, the where, and the how. The last two, when it comes to putting campus health policy together, is including measures for the entire campus. Like I talked about earlier, when you have those three different types of campus policy, the one that's most comprehensive is going to include supportive measures for all of those departments that could potentially be impacted, whether it's housing, dining facilities, and especially academic buildings. Is you want to make sure that there's measures in place for what happens if a student tests positive and they say, well, I was in, the Johnson building on floor 3. So now what is your policy for responding and decontaminating that building? If you don't have a policy in place that says that, what are you going to do if the student says, I was in the residential hall on the Hill for 3 days before I came down here? So now what is your policy for responding and addressing that need in a residence hall or a dining facility? And then lastly, I think most important is making it accessible. Your policy should be made available to your entire campus community, both online. I put in print because you do want to have some print copies, because as you put these out, you might get media requests that ask you to send copies of this. If you do have campus visitors, you might want to make these copies available, and you might want to mail these out when you're sending out your welcome packets for your students that are still being accepted. Or if you're sending information in the mail still, it doesn't hurt to just slip in a little index card or a little postcard that highlights some of the key areas of your return policy so those students know. Communication is key. When we're talking about a communication plan, I don't think I can stress this anymore. If I can do a whole presentation on communication, I probably would, because I think this is where a lot of misinformation gets lost. I think this is where we lose a lot of students that don't want to return, that spread false information online, because we don't communicate as universities and especially as student health centers about what is going on. So communication is key when it comes to engaging your population, whether it's students, faculty and staff, the general public. You want to make sure your message is unified. Ensure that all messaging is representative of your campus. You want to make sure it's timely and transparent, and you also want to make sure it's delivered through multiple platforms. Right now, social media our websites, our email, these digital platforms, technology should be your best friend. If you have people that don't know how to use technology, those are not going to be people that make it through this, because our students are using these platforms to engage, to get information. And if you as a university have not stepped up to the plate and have embraced this technological revolution and have used these tools and shown that you can use these tools, because these students can look and they can know when you don't know what you're talking about. They can know when it takes you forever in a day to figure out how to just send an email or to upload a video. So you want to make sure that you are using these platforms to engage students across all platforms. So that way you engage in multiple stakeholders. The transparency of your communication is key. You don't have to tell students every single thing that your executive committee talks about, but you do want to make sure that if there is important information that needs to come out, that is transparent. If you don't know, then you just don't know. Like, and that's the most important thing, that students, how you build trust and how you build rapport to ensure students that are loyal to your brand, because your college is a brand. Your students represent your college, whether they there or not. Right now, while these students are home, they're representing your brand and they want to come back. But if you're not delivering effective, timely, transparent communication about what's going on, you can believe will flip on you so quick. These students will flip like super quick. But the last thing you want to do is have your students spreading false information about what your college is doing. So that's why it's so important to have these communication measures in place that are effective, that are timely, that are transparent, that are unified, and that are delivered through multiple channels. I know this is a huge undertaking, so that's why it's important that you partner with those different departments that I talked about in the previous slide. And when it comes to your communication measures, I think the Office of Marketing and Communication that you have on campus should be your best friend right now. You should try to connect with them on a regular basis, whether it's sending emails, whether it's saying, hey, we have this message that needs to go out. Hey, can we partner with you about how we deliver effective messaging to our campus? The primary information that should be coming out from your college campuses right now should be focused on the health and well-being of students and reopening, period. That should be the primary messaging that's coming out. Because within that messaging, you can talk about entrance requirements. You can talk about on-campus measures. You can talk about what we're doing in the fall. You can talk about academics. You can talk about graduation. You can talk about all of these things, but it still needs to be up under the foundation of health, safety, and well-being being the priority. And your communication departments can help you structure these messages in a way so that it goes out to the right people, it's effective, it's timely. But with that being said, you as the student health professional need to be the one that is structuring this messaging to ensure that it's effective, that it's factual, and that it's succinct. So that is my presentation for today on reopening. I hope that I was able to provide you all with some valuable information that can help guide your reopening plans. I put my contact information here because, like I said, this is not going to stop here. These webinars are a series. We're going to continue them. And I also wanted to provide my contact information because I would love to support your campus. If you found some of these details or some of these this information that we had here today to be effective and you want to get a little bit more support, you want to see how you can actually develop a communication template, you want to see about how I can actually develop a policy, please reach out to me. My email address is down there. It's hello@hbcu.health. And I would love to work with you one-on-one, whether it's your entire campus, whether it's just your student health and well-being portfolios, whether you just need, like I said, just a little extra support on even developing effective social media messaging, whether it's putting policies together, anything that goes around making your health and well-being portfolios on campus stronger, please reach out to me if you would like to collaborate. Like I said, we're continuing to put out content and webinars and information around HBCU health. Right now, the focus is COVID-19. But once this passes, we're going to continue to do this valuable work and continue to develop and provide supportive measures and information for students. So please, I'm looking to collaborate with all 100 HBCUs, all 100. We've already started building some strong partnerships with several, but if we have not connected, please, please, please send me an email. If there's other questions or comments or concerns that you have, if you want to connect with other individuals that were on this call and you want their contact information, please let me know and I will definitely help facilitate that. But like I said, my whole purpose today was to provide this information to make your life easier and to offer support for you as a healthcare administrator, but also as a student. So please, I would encourage you all to definitely to, continue to engage, to, like I said, share those resources with those individuals. But I thank you all again just for the important work that you've been doing and that you will continue to do. I'm just going to check the question box real quick to see if we had any other comments or questions. So before we wrap up, please, anybody, if you have any questions or comments or concerns or any feedback, you can add that in the chat box now or in the Q&A section, and I will try to answer those to the best of my ability. Somebody asks, are campuses prepared to address the mental health of students newly enrolling? This is especially true for those students that are experiencing vicarious trauma. I agree 100% on the mental health piece. And we talked about that a little bit. That's why it's so important that I would encourage you to continue to offer those mental health services to your students right now during this time. Like I said, I will work with your senior administrator to ensure that you can provide and offer those mental health counseling services and let your students know they're available. I think that's what we forget a lot is we offer all of these services, but then we forget to market them and tell students that are available, especially for those incoming students that are unsure. We work with your Office of Enrollment, Management, and Recruiting. Those offices are always looking to partner with other departments because their outcomes are based on student enrollment. And if you as a supportive office or a supportive department can help that, they're definitely going to work with you. So get with those offices. They already have databases of students that are incoming freshmen, and you can even get those databases and start contacting those students, start connecting with them. Say, send out an email, send out, information, send out, things that can support those students and let them know, hey, we have these services available. You might have some restrictions on if you can provide actual direct services, but you can definitely link them to your social media pages. And that's where you can start engaging with those students. It doesn't necessarily have to be a direct, send it to their email. And most students don't check their email anyway. So use social media as a way to engage students right now. And like I said, those offices of enrollment management will have that contact information for those students and address it. Like I said in my opening, address some of the trauma that our students are dealing with. Let them know that you understand what's going on and you understand how challenging these things can be. Because when you relate to a student one-on-one, that's when they're going to remember you. That's when they're going to remember you. They're going to say, hey, I remember when I was still thinking about coming on campus, that health center reached out to me and they were there for me. They was there to listen to. That's what those students are going to remember because they're getting bombarded with information, but they're going to remember that. Effective health policy is key before starting contact tracing. I agree 100%. When you're developing that policy, I would definitely include something about contact tracing. Even if it's a small measure, you still want to have something in there about what that's going to look like. Even if you don't call it contact tracing, you want to have something in there that says, these are our steps that we're going to do if a student tests positive on our campus. Because that's what's going to happen. That's what you're going to get asked. That's what's going to determine whether these parents send their students to your campus or not. And I'm pretty sure if you haven't already been asked that, you're going to get asked that question. So what do you do if somebody tests positive? And if you can't point to a policy or send them a link to something on your website that says what you do, you're going to be looking real weird out here. And that's going to be determination between them picking North Carolina Central over North Carolina A&T. I had to do that. It's Aggie Eagle. I had to do that. I had to say something about that. Thank you, Daniel, for that feedback. Thank you for the support. Aisha Griffin, that is so crazy because that's my wife's name, Aisha Griffin. I thought that was her that was logged in. But thank you for joining us today. I've seen your name on a couple other webinars, so thank you for joining us. Again, that's going to conclude our conversation today. Like I said, the recording, I will send you all a follow-up on this recording. I'll send you the link so you can download it because I want you to have access to this information. I will also send you a link to the presentation so that way you can have access to that as well. And I'll send you a couple resources that you can use from the American College Health Association reopening considerations, as well as some considerations from the CDC, as well as some links from some other HBCUs that have already implemented reopening plans. So look out to your email to get this information. And like I said, please connect with me. I'm here to support you all. I want to be able to connect and I want to be able to support you on a one-on-one basis. So if there's some type of support I can provide, if you are looking for an outside consultant, if you need support putting policies together, this was just a general overview, but if you're looking for something more specific to your campus, please reach out. Like I said, I have, from you reading my background, I have a lot of experience when it comes to college health, especially working with HBCUs. I have done a lot of work with the American College Health Association, which I would also encourage you to join. We have an HBCU coalition that meets once a month within that organization where we put these things together and we have these conversations. I also just recently found out that I'm on the board of directors for the American College Health Association. So that's a great opportunity for us to expand our work in a national organization, but I would definitely encourage you, please reach out and let's work together, because it's going to be up to us to ensure that the health and well-being of our students stays at the forefront, and that we continue to provide resources for them that can get them through this time. So thank you all again. I enjoyed speaking with you today. And the last thing I do want to say is, we talked a lot about students and their needs, but please, please, please make sure that as healthcare professionals that you are taking care of yourself. Self-care is the most important thing that you can do right now, is to take some time off, to focus on what matters, and to continue to take care of yourself. Because if you aren't completely full, how can you expect to pour into other people? So please continue to take care of yourself, take care of others. Enjoy your weekend, and I hope you all have an amazing day and continue to stay well. Thank you.